Hey Invictus people, let us this time do some foodborne, waterborne illness stuff. The bloody poops, the non-bloody poops, they love it on tests. It's obviously a very common ER urgent care presentation. So let's just do some broad strokes, and then in coming weeks we'll get into this in some detail, but they really like to examine on this. So I'm getting a lot of my information here out of the Compendium. Now, in Compendium, it's electronic. It's on your phone, it's on your computer, but I'm just a guy that likes to, when I'm reading, to have a piece of paper. I'm old school, so you'll see me do this. So here are some of the broad strokes themes when it comes to diarrhea. First of all, the most important thing is that the vast majority of diarrheal illnesses, getting the poopies, is viral, self-limited, no treatment, no testing needed. And that will come up on the exam. So it'll be a young person who's got some poopy, but there's no blood, they're not immune suppressed, and what do you do with this person? And the key thing for that person is to basically do supportive care. If they've got a bit of a fever, treat the fever, and then it's all about hydration. And the key thing with the hydration is that it is oral rehydration. You do not need to slap in an IV, you don't need to send electrolytes, you don't need to do anything for these routine cases that come in. You can basically orally rehydrate. How do you do that? One of the answers might be something like Pedialyte, rehydration solution, or some other version of that. That is actually a trade name, I believe. So a rehydration solution, fine. They don't want you to use Gatorade and sports drinks because they have too much electrolyte, too much glucose most of the time, which can actually make the diarrhea worse. In the real world, you can use them, but you need to dilute them a lot, like to about a quarter of that. You can make up your own treatment, and that own treatment is, one moment please as I look it up, because I believe it is half a teaspoon of salt, 6 teaspoons of sugar into 1 liter of fluid. But we're going to look at that. Yes, that's right. It is half a teaspoon of salt, 6 teaspoons of sugar, and 1 liter of water. Okay. You can also give them anti-nausea agents like ondansetron. That's fine. Now let's talk about whether you should give them anti-motility agents. Stop them pooping in their pants. Yes, you can do that. The classic one is loperamide. They do not like loperamide in kids under the age of 2. And in general, they don't like to use loperamide, these anti-motility agents, or simethicone or other stuff as well. But in the real world, you're probably going to use them, but not in the little kids. Now, we don't want to use anti-motility agents in patients who have bloody diarrhea. That sort of bacillary dysentery-like syndrome, high fever, bloody poops. Generally, you don't want to use anti-motility agents. But this is very, very controversial. And on the exams, it's not sure if they'll do that, because it turns out that if you're giving antimicrobials to somebody with that bloody dysentery syndrome, you probably can give anti-motility agents and they do fine. The other big thing that there is fairly much consistency on the exam is don't give antimicrobials to kids. This generally is associated with an increased production of the Shigella toxin, which can make them develop the complications, things like hemolytic uremic syndrome. So you want to avoid antibiotics in kids. But the vast majority, let me go back and say this again. Vast majority is self-limited. It's non-bloody, it's viral, and they just get better on their own. You don't need to do any testing. You don't need to do much of anything except to rehydrate them. We talked about the rehydration solutions. Now, if they're giving you a case of a patient with bloody diarrhea, classically the bloody diarrhea will also be associated with fever. This is the dysentery-like syndrome, bacillary dysentery. This is often caused by bacteria. The classic ones are Salmonella, Shigella, E. coli 0157H7, and what's the other one? Campylobacter. So these you can actually treat with antimicrobials. This does appear to reduce the duration of symptoms. These can have significant complications, particularly in the very young, the very old, the immune suppressed. In that case, antimicrobials is fine. Generally, the new thing that's changed over the last few years is we start with azithromycin, not with fluoroquinolones. The fluoroquinolones are associated with a lot of side effects, but also with a significant amount of resistance. So that's sort of, for me, sort of the new thing as an old guy. And in those circumstances, if you're giving antimicrobials, I don't think they're going to ding you for using something like an anti-motility agent as well. But just know in kids, they really do not like anti-motility agents, and they really do not like to give antimicrobials. But if the kid is sick, high fevers, it's been going for a while, then culture the poopy and then give antimicrobials is probably the right thing to do. We'll talk about pregnancy and other stuff later. I think that's enough for now. Is that a broad enough overview to begin? And then what we'll do is we'll dive into some more specifics later, and then sort of the high-risk groups, like pregnancy and other ones. All right? Herbert out. Oh, I should say that we are working really hard. We've got lots of faculty, and it's going to be pretty good. We are pushing this, trying to get it out in late summer. I don't know if we'll get there, but it's all happening. And you better be watching the pit because it's awesome. Herbert out.